Hi, my name is Christine Walsh, and I'm going to be presenting my validation video for the irrigation of PEG tubes. The first thing that I'm going to do is make sure that I have the order from the physician. So I have my order. The next thing I'm going to do is I'm going to ask my patient for 2 identifiers. Hi, Mrs. Jones, can you please tell me your first and last name? Once she does that, I'm going to also check that against her wristband. Alright. Cool. Hi, Mrs. Jones. My name is Christine. I'm going to be your nurse today. I'm going to be irrigating your PEG tube. If you have any questions about the procedure or have any pain or discomfort, please feel free to let me know. The next thing I'm going to do is I'm going to gather up all of my materials, which I have here on this table. I'm going to bring my patient up to a working level.
Because she lives in Westwood, I live in Ridgewood, so we just stop by my house. Everyone kind of lives away from us. We think she has to kind of drive my way to get to the highway.
Alright. And I'm going to bring my patient to 45 degrees.
They were all saying it's
I'm going to first listen for vowel sounds.
Like the night people go to Oregon. You're going to have a lot of family members going, excuse me, where's your student?
Okay. I've listened for my vowel sounds, everything sounds regular. So I'm going to take my stethoscope off. I'm going to go wash my hands. Okay. I'm going to get my gloves on. I have my gloves on. The next thing I'm going to do is I'm going to make sure I have my syringe near. Before I disconnect my tube, I'm going to make sure I have padding down just in case we have any messes. I'm also going to then turn off my machine. I'm going to clamp my tubing, disconnect the tube. Okay. I'm going to put my syringe in here, into the tube. So now that my syringe is in the tube, I'm going to see if any stomach contents comes back. If 100 milliliters or more of stomach contents comes back, I'm going to record it, record the color, the odor, the consistency, if there's any particles in it, and I'm going to alert the physician. The next, if there's less than 100 milliliters of fluid that comes out, so we're just, in this case, I guess only 15 came out, we're going to push that back into our tube, okay? We're going to reclamp the tube. All right. We're going to take our syringe, we're going to get 30 milliliters of either saline or tap water. We have our 30 milliliters. We're going to unclamp our tube, push this water in. All right, we have our 30 milliliters in. We're going to reclamp the tube and disconnect our syringe. All right. We're going to dispose of this. Reattach our machine, not turning it on yet. We're gonna set that down. We're going to assess the area right over here to make sure nothing looks wrong or infected or anything. Once that's done, I'm going to take my protective padding. I'm going to discard of this. I'm going to cover my patient back up. All right. How are you doing, Mrs. Jones? All right. My patient's covered back up. I'm going to turn my machine back on. After that, I'm going to bring my patient back down to the lowest level. Okay. Going to bring her head down. Again to the lowest level. Alright, she's back down at her lowest level. I'm going to make sure that she is comfortable. Are you comfortable, Mrs. Jones? She's comfortable. I'm going to make sure that the call light is in reach of her hand right over here. I'm going to then clean off my equipment. I'm going to take off my gloves. Okay, my gloves are off. I'm gonna go wash my hands, and then I'm gonna go record everything in my I&O report and alert the physician of anything that was wrong. Thank you.